Okay, good morning. My name is Jessica Neal, and I'm going to be talking to you about eczema today. So what is eczema? Most people think that it's a specific diagnosis or condition, but in reality, it's the general term for any type of dermatitis or inflammation of the skin. It can be either acute or chronic. There's also subacute types. Most types cause red, swollen, and itchy skin. As you can see in this illustration here, this is a normal skin, and then this is eczema skin, and it's a broken barrier of the skin. It's cracked, and it can allow bacteria to come into the skin and cause infection. So some types of eczema, the causes are known. Other types, it's not fully understood what causes it. But some of the things that we know can cause eczema include exposure to irritants or detergents, genetics, an overactive immune system, and then a possible combination of all those factors. So as you can see, there are many, many types of eczema. Some of these things you may not have even known were classified as eczema, including contact dermatitis, lichen simplex chronicus, hand and foot eczema, and atopic dermatitis. This is nummular eczema, the circular, and that one right there is contact dermatitis by some jewelry that she's wearing. I chose the most common type of eczema, which is atopic dermatitis. Atopic dermatitis is a long-lasting condition. It is chronic. It usually begins early in life. Sometimes we see it in children even under the age of 1. And about half of the people who developed atopic dermatitis as children will carry it on into adult life. So that's a pretty big percentage, 50%. It typically appears on the elbows, behind the knees, on the hands and feet, but it can also occur on the face, chest, and neck. So you can see it almost all over the body. It tends to flare periodically and then subside, and there is a genetic predisposition. So the symptoms, most of the time you'll see red to brownish colored patches similar to this. This one also has the small raised red bumps, which can leak fluid and crust over when they're scratched. Most people have a hard time not itching when they have this type of eczema, and so they can cause lesions in their skin, which you'll commonly see. Like I said, it comes and goes. Sometimes it can subside for up to several years and then come back again. Inflammation usually begins suddenly with redness and severe itching. So there's a few different phases of eczema that we could see. Acute, usually you'll see the oozing and vesicular lesions. Subacute, they're more scaly and crusted. And then chronic, you have a dull red and pruritic skin. Thickened, cracked, scaly, raw and sensitive from scratching, like I mentioned. And without treatment, the skin can permanently thicken, also known as lichenification. So these are the common triggers. There can be others, but these are the most common. You have your soaps and detergents, your cosmetics, clothing, especially scratchy clothing like wool, and also tight-fitting clothing. Jewelry, a very common piece of jewelry to cause this is nickel. Sweat, which can be very hard to control out here. Temperature changes, excessive heat, and then cold, dry air. Also, sudden temperature changes. So let's say if someone were here and then they fly to Antarctica, maybe they'll have a flare in their eczema. Stress, and then also allergens, the environment like dust, pollen, and mold. So diagnosing eczema is based on a strong medical history and asking the patient all about their symptoms. We'll need a complete medical history. It's also associated with asthma and hay fever, so it's going to be very important to ask the patient if they have either of those. The family history for the genetic predisposition. Symptoms, when do they occur, how often, are they associated with anything? If we can find what the symptoms are associated with, then maybe we can help prevent the flare-ups. Of course, a good examination of the skin. And then if there are any signs of allergic reaction, we may order a test called the patch test to find out maybe what the specific allergens causing the reaction are. And then eczema can mimic other skin diseases, so it's important to rule out others. And then this is just kind of a chart showing the different symptoms and if we have a mild, moderate, or severe case. Treatment goals is really to make the patient more comfortable, prevent flare-ups, relieve discomfort. We want to restore and preserve the skin barrier, try and prevent infection, control and eliminate inflammation, control the aggravating factors, like I said, so trying to pinpoint what's causing it, prevent it from getting worse, calm the skin, reduce stress, and then prevent infections. Okay. Treatment. Treatment can be difficult with eczema. It's going to require frequent follow-up and close care with the provider. It can take some trial and error with all of these things to find the right combination for that patient. The most simple treatment, of course, is emollients and moisturizers without fragrance, but that's not going to be enough for most people. We can use ultraviolet light, oral antihistamines for the scratching, antibiotics, of course, if an infection is present. And then our most common, we have the topical steroids. Hydrocortisone is more for sensitive areas and the face. And then whereas triamcinolone and clobetasol are more for trunk and extremities. We also have our topical immune modulators, Protopic and Elidel. Not every patient's treatment plan is going to be the same. What may work for one patient isn't necessarily going to work for another. So we have to work very closely with them to find their specific plan. But as you can see in these, we are able to clear their symptoms. This is one of the most important parts, is preventing flare-ups. Lifestyle modification is key to this. They have to be persistent about trying to control what they know maybe causes their flare-ups. We have the moisturizing. We want it to be frequent and at least twice daily, and apply after bathing. This allows the skin to absorb the moisturizer better. You also want to choose a thick cream or ointment and that's fragrance-free. We have good moisturizers here. CeraVe, Cetaphil, and Aveeno are always good creams. Bathing, you want it to be lukewarm, not hot. That can aggravate the skin. Mild cleansers, again, pat dry, don't rub, because that can irritate the skin. And then avoid overbathing and hand washing. You want to limit contact with anything that irritates the skin, of course, and limit exposure to the environmental triggers like pollen, dust, and mold. Now this one, again, like I said, over sweating and overheating, that can be very hard here. So we want to work with the patients and see, what are possible ways to not sweat too much in the summer. Stay indoors, bring a cool towel, misters, things like that. Avoid sudden changes in temperature. Cold compresses help for itching. Dress in loose-fitting cotton clothes. And it doesn't have to be cotton, but just fibers that don't irritate the skin, like wool. You wouldn't want to wear wool. Reducing stress, so finding things to calm yourself down. And then, of course, follow the prescribed treatment regimen. So it's hard to determine when or how often the symptoms are going to come out, but what we can do is help prevent flare-ups and reduce symptoms and give relief.